bilirubin metabolism first, and this is super interesting story which I'll tell you. So first, to understand the story, always remember that bilirubin is a byproduct of hemoglobin. So hemoglobin breaks into heme plus globin. So this heme, when it is formed, this heme is broken down into biliverdin. First thing that happens is formation of biliverdin, okay, by heme oxygenase enzyme. Now this biliverdin is further broken down into bilirubin by biliverdin reductase. So this biliverdin reductase forms the bilirubin. So bilirubin is now formed. So this bilirubin is a new baby which is formed. Why? So when it is a new baby, doesn't, it is not water soluble, it doesn't know swimming, so it is water insoluble, okay, so water insoluble, and it doesn't know where to go. So albumin is his mother and comes and holds him and says, come baby, come with me. So bilirubin binds with albumin and is moving in the blood, okay, so it's released it's in the blood and it is moving with albumin in the blood, but it is insoluble, it doesn't know how to swim, it's an insoluble, okay, it's a molecule now. So but it circulates with albumin, okay. So now it is circulating with albumin in the blood. Now let's see what happens when it reaches the liver. Okay, so quickly let's revise the bilirubin metabolism that we have started. So bilirubin is formed from heme. Once the bilirubin is formed, it enters into the sinusoids of the liver. In the sinusoids, in the blood, it is bound with albumin, and this is called unconjugated bilirubin. Now, once it enters into the sinusoid, from the sinusoid, it has to enter into the hepatocytes. So for doing that, there is a channel at the end of the sinusoid which is called as OATP. With the help of OATP, this bilirubin enters into the space of Dice, where it binds with glutathione transferase, which prevents its regurgitation back into the sinusoids. When it remains in the space of Dice, it is pushed into hepatocytes. In the hepatocytes, it binds with UDP glucuronyl transferase, which helps in conjugation, leads to formation of bilirubin diglucuronide and bilirubin monoglucuronide. 80% of the bilirubin is diglucuronide, only 20% is monoglucuronide. Now once it is conjugated, this is what is called as conjugated bilirubin. Once it's conjugated, it is then thrown into bile ductules with the help of ATP dependent channel called as ATP dependent multi-drug resistant protein 2, which basically takes this bilirubin into the bile ductules. These bile ductules carry the bile and take it to the bile duct, and from the bile duct it is secreted as bile, okay, from the liver. Now here is one catch that you have to remember here. See, normally we have started this complete pathway, okay, so you have to remember one point here. So normally if there is blockage of this molecule, that is MRP2, that is ATP dependent MRP2, if it is blocked, okay, then what is going to happen is, sometimes what happens is that this excess conjugated bilirubin, okay, so once or if there is a block, or if there is excessive formation of conjugated bilirubin, what will happen is that this conjugated bilirubin is so much that it cannot completely pass through MRP2, okay, so MRP2 will not be able to completely take whole of this bilirubin. So what will happen is, there is one more gate which is present in the hepatocytes. This is called as multi-drug resistant protein 3, MRP3. So this is another channel here which normally remains closed. But when there is so much excessive conjugated bilirubin which is formed, this excess bilirubin starts passing through MRP3 back to the sinusoids. So this conjugated bilirubin will start passing from MRP3 back to the sinusoids. So should this normally happen? No, normally it will not happen. Why? Because what bilirubin is present in the sinusoid, in the blood, it is unconjugated bilirubin, which is normally bound with albumin, okay. But rarely, whenever there is excessive formation of conjugated bilirubin, then through MRP3, this can regurgitate back into the sinusoid. Once this bilirubin comes into the sinusoid, it is a child, so its mother will recognize him and say, oh, my beta is back. So albumin will bind with it and it will circulate in the blood. So this is very rare. Normally circulating bilirubin is usually unconjugated bilirubin, but can conjugated bilirubin also circulate bound with albumin? Rarely it can. When there is excessive formation of conjugated bilirubin, then yes. Remember this point, okay. So this bilirubin which regurgitates like this is also called as this conjugated bilirubin, which regurgitates back into the sinusoid and circulates with albumin, is called as delta bilirubin. What is this called as? Delta bilirubin.